we divided the symptoms of an allergic reaction down into those of a mild to moderate allergic reaction or to those of a severe allergic reaction. I'll just run through those now. The symptoms of a mild to moderate allergic reaction, we are talking about their swelling of the lips, face or the eyes, hives or welts, that's the itchy rash, tingling mouth, and abdominal pain or vomiting. If you are suffering any of those symptoms and you suspect you've been exposed to the thing you're allergic to, the first thing you need to do is to take antihistamine tablets. The brand we recommend is cetirizine. You can buy those over the counter very cheaply. They're all the same size, they're all 10 milligrams, so there are no extra strong versions. Within 15 to 20 minutes, they should start to alleviate those symptoms of itch and rash and tingling around the mouth and tongue. However, if at any point you start to develop the symptoms of a severe allergic reaction, which are those affecting your airway or your breathing or your blood pressure, then these symptoms override whatever you're doing with your antihistamines, because these are symptoms that are potentially dangerous. So to describe those symptoms more fully, we're concerned about swelling of the tongue, swelling or tightness in the throat, difficulty talking or hoarse voice. If your breathing becomes difficult or noisy, if you develop a wheeze or a persistent cough, then there are symptoms affecting your blood pressure, so if you're feeling persistently dizzy or feeling as if you're going to faint, or actually if you do faint. If you develop any of these symptoms, they are possibly the symptoms of a severe allergic reaction. So what we advise you to do then is to lie flat with your feet up, which is just to get some nice oxygenated blood to your brain so you don't faint. Stay put. Don't ask anyone to put you in the car and drive you to the hospital. It's important the ambulance can find you where you are, so stay put. Call 999 for an ambulance and say you're having anaphylaxis. If anyone's there with you, that can be their job to phone, say you're having anaphylaxis and get an ambulance there. And in the meantime, you use your adrenaline pen. The adrenaline pen I'm going to demonstrate to you is an EpiPen. This should look familiar to you if you already have an EpiPen. It's very similar to the real pen. It's stored in a clear Perspex tube with a yellow cap. So when you need it, you've got it out of your Perspex tube. Hold it in your dominant hand. I'm left-handed, so I'll hold it in my left hand. It's given as an injection into the muscle of the thigh, this big muscle here. If you're holding it in your left hand, inject into your left thigh. If you're holding it in your right hand, inject into your right thigh. The needle will go through your clothing. You don't need to pull your trousers down to use it. You just avoid any big seams, anything in your pockets, wallets, phones, purses, whatever. Holding the EpiPen in your dominant hand, keep this thumb tucked out of the way. You don't need to press any plungers or anything, and if in your enthusiasm you had the pen upside down and your thumb was there, you would inject your thumb, which wouldn't help you. So holding it that way, thumb tucked away. With your other hand you pull off that blue safety cap. The pen won't do anything with that still on. Then you're going to aim at that big muscle on your thigh. There's a spring-loaded mechanism in here which needs a fairly firm blow on your leg for it to discharge, but it's really just the weight of your arm from a height of about 20 centimetres straight down into your leg. You'll hear a click, which is the mechanism working. Keep the pen pressed firmly into your thigh for a slow count of 10, so roughly 10 seconds. 1 elephant, 2 elephant, 3 elephants up to 10, and then straight back out again. You won't see that needle either before or afterwards. It's sheathed before and it's sheathed again afterwards. Adrenaline works quite quickly, so within about 4 minutes you should find that those symptoms of swelling of the tongue, difficulty breathing, should start to be relieved.